symptom of Osgood-Schlatter disease. This video is a shortened version of the paper published in 2014. We would like you to understand the symptoms by looking at the images of the ultrasound observation device, and in the case of Osgood-Schlatter disease, we would like you to exercise so that the patellar tendon and tibial tuberosity are not stressed. Osgood-Schlatter disease is a common disease encountered in the practice of judo therapists. One patient who came to me had pain in the affected area, even when riding a bicycle. I had treatment, but it actually took a long time to heal. Reflecting on this, I wondered if 3 could be a good treatment for Osgood-Schlatter disease and an early recovery. Osgood-Schlatter disease occurs during important time of students' sports activities. Conservative therapy includes cessation of sports activities, restriction, icing, stretching of the quadriceps, taping, use of supporters, administration of anti-inflammatory analgesics, and physical therapy. If the symptoms become chronic, treatment is difficult, and long-term sport activities must be stopped or restricted. I observed the condition of the affected area with an ultrasound device and found that the tibial tuberosity had deteriorated more than expected. From this, I was able to obtain hints for a new treatment for Osgood-Schlatter disease. The current supporter for Osgood-Schlatter disease is designed to reduce traction on the tibial tuberosity by compressing the patellar tendon at the lower part of patella and the upper part of tibial tuberosity. I believe that this action alone has little therapeutic effect, and that compression of the entire tibial tuberosity is necessary in patients with severe damage to the tibial tuberosity. Used equipment MyLab 25 manufactured by Esaute. Probe use 15 MHz linear probe 424. The echo image is over 10 years old. At that time, digitalization was on the rise, and soft tissues such as muscles and ligaments could be seen clearly. Subject. The subject was a 14-year-old male He was a junior high school student and had a baseball club. He had swelling, tenderness, and spontaneous pain in the tuberosity below his left knee joint. He has pain while walking and running, and also has pain while riding a bicycle. This photo is to show the scanning of the probe, not the test subject. Long axis image. Move the probe parallel to the bone axis. A video of echo images will be played. The duration is 10 seconds. The echo image moves from the patella to the patellar tendon to the tibial tuberosity, and an irregular image of the bone surface can be observed on the tibial tuberosity. Short axis image moves the probe perpendicular to the bone axis. This is a short axis image video. The irregular image of the tibial tuberosity can also be observed here. It is a combination of 3 long axis images. Next, we will observe the patellar tendon above the tibial tuberosity. There is a hypoeconic area below the patellar tendon and a hypoeconic area with an unclear fibular pattern on the patellar tendon. Therefore, patellar tendonitis is also considered to be involved. This figure is an ultrasound image of Osgood-Schlatter disease in a 6th grade elementary school boy. Damage to the tibial tuberosity and cartilage can be observed. Cartilage appears dark because it is observed with low echo. This image can be observed at a slightly distant place from the previous image. The hypoeconic region between the breasts is considered to be cartilage. Why is the tibial tuberosity so vulnerable? Looking at the echo image, the cartilage of the tibial tuberosity, which is gross cartilage, can be observed dark with low echo, and it can be seen that it is softer than the surrounding bone tissue. It is not a mature bone and is very susceptible to damage. Therefore, the tibial tuberosity is easily damaged by the traction of the patellar tendon during knee flexion and extension. There was extensive hypoechonic malformation of the tibial tuberosity, which we considered to be the stage of avulsion and caress over bone formation. Observing the state of the tibial tuberosity damage in Osgood-Schlatter disease by ultrasound. If the symptoms are severe, it is close to the state of avulsion fracture due to traction of the patellar tendon. Therefore, we believe that the tibial tuberosity and patellar tendon require brace therapy with compression. It would be even better if the knee joint had limited range of motion to prevent damage to the tibial tuberosity from traction on the patellar tendon. It is important to note that there is component syndrome in the lower leg, and it is necessary to apply excessive pressure to prevent circulatory failure in the lower leg. Even in cases of mild Osgood-Schlatter disease, it is important to apply prosthesis and taping to the entire tibial tuberosity. After the case introduced this time, I performed brace therapy that compresses the tibial tuberosity and the patellar tendon in 3 patients with Osgood-Schlatter disease. Also, there were differences in the therapeutic effect depending on the degree of damage to the tibial tuberosity and activities of daily living. The bandage fixation using an orthosis resulted in good progress and healing. I think I was able to recover quickly. I hope it will be useful for you. Thank you for your attention.